So honored that you're all here and very excited. This is the home of the Ouachita Children's Coalition. This house, this center is going to house both CASA, where we work with foster kids and advocate and make sure they don't fall through the cracks of the foster care system, as well as the new MENA Children's Advocacy Center. No, please, come on in. An advocacy center is where they bring children that they believe have been the victim of physical or sexual abuse. They are designed to reduce trauma in every way they possibly can. Every child that walks in here, we want them to feel welcome. We want them to feel like it's cozy. We want them to feel like it's a safe space for them to share their story, because it is all designed to find out exactly what happened or what possibly didn't happen and help them heal from that trauma. So when they walk in the door, they will immediately be greeted, and then we're going to bring them back to the family room that I'll show you in just a minute. We're going to explain exactly what the process is, answer any questions they might have, and then we're going to start the process of the interview. So in a CAC, there are 4 main components to it. They will have a forensic interview by a highly trained forensic interviewer. Her name is Tandy. Is she in here?
She's outside.
Oh, okay. She has gone through a lot of training in how to ask age-appropriate, non-leading questions. We're also going to have anatomically correct dolls, everything that we need to find out the information that we need, which I'm about to show you. In that room, they'll ask all the questions. It's going to be recorded and live streamed into the room across the hall. In that room, DHS, law enforcement, prosecutor's office, whoever needs to be there, whoever needs to find out that information to help that child, will be observing that interview live. They will be watching and listening. They'll be deciding, how do we proceed from here? Do we need to go arrest somebody? Do we need to do further investigating? Is this a situation where it was kids playing and we don't believe actually any sort of sexual abuse occurred? Or do we need to go remove these kids from their house? Are the parents the offenders? You know, they are making that decision. So during the interview, at the end of the interview, the interviewer will leave the interview with the child, go into the room, the observation room, and say, are there any more questions? And they'll find out if they want to ask any other questions, because we don't want these kids to have more than one interview. These centers are designed to reduce the amount of interviews that kids have always had to have in the past, which I'm about to show you. In that room, let's say they would tell their school teacher, and then the school teacher would go get the school therapist, and then the school therapist would go call DHS, and then the child would have to repeat the story over and over again. That is so traumatic to a victim. On top of that, the more times you tell a story, the more likely it is to change. Even though you know exactly what happened to you, it's more likely to change. Well, when that happens, then it's less likely that we're going to be able to prosecute or remove a child if need be, or whatever they need. So they've had the interview, then the people are sitting in, DHS and so forth are sitting in and observing, and then hopefully when they feel like they've gathered all the information they need, they stop that interview. If the child needs to have a medical exam, we're going to have a sexual assault nurse on contract, so we can do the medical exams here. They're again designed to reduce that trauma, not having to take them up to the hospital, which is, kind of a scary environment even for adults. We don't want kids to have to go through that. So we can do all the testing, anything deemed appropriate that child might need. Not every child needs a medical exam. This is just going to be, very few of our cases, but we want to be able to provide that service if need be. The other service that's going to be provided is therapy. We have a trauma-focused cognitive behavioral therapist on contract. She's going to be able to provide therapy to all of these children and the non-offending parents. Because we are paying this therapist, we will not bill insurance, we will not bill Medicaid, so she won't have to give a certain diagnosis, she won't have to follow any strict criteria. She can provide whatever services, whatever kind of therapy that this child might need or the family might need. That's huge. That is huge. We're here to help those kids in every way without having our hands tied by any, strict insurance or anything like that. Everything in a CAC is free for the victim and for their families. Okay? And so the other thing that the other person that will be appointed, not appointed necessarily, but working with the family is an advocate. This advocate will be the person that kind of explains to the child what's going to happen, what the process is, will stay with the child after the interview, help them process, give them snacks, give them a stuffed animal, and provide help. So if this perpetrator goes to jail, this advocate is going to help prepare them for court, is going to sit with them, offer just any sort of support that the families might need. And let's say dad's the offender. Mom doesn't have a job. Mom, suddenly is trying to support these kids without having any sort of an income and might even possibly lose her house. We're going to help with everything that we can to help the family heal and move on. So